lips that are proportionate to the face are a key element to appearance and beauty. And you'll see great looking lips as a part of nearly every fashion model in every magazine. Lip enhancement procedures have become tremendously popular. They can be done relatively simply and can have a great effect on the overall appearance. There are several options available for people looking for improvement in their lips, and what's key is an in-depth facial analysis to understand exactly what the patient wants to improve, as well as their underlying anatomy. Number one is a lip augmentation. Sometimes due to time, genetics, or loss of volume, patients can have deflated or thinner lips than they would want. For these patients, a lip augmentation can be a great option to improve the overall fullness and sensualness of the lips. We can perform lip augmentation in the office with Juvederm, which is an over-the-counter hyaluronic acid filler. We can inject this strategically into certain areas of the upper and lower lip to give an overall increased volume and great curves in each. Some patients opt for a more permanent solution in the form of facial fat grafting. With this procedure, we take fat from certain areas of the body, we can refine that, and then we inject that and transfer that into the lips in this case. Again, this is a great option and can get great results, and is often really ideal for people wanting a longer lasting appearance or people already going to surgery for other reasons. The second most popular procedure is a lip lift. This is really good for patients who have an increased distance from the bottom of their nose to the top of their upper lip. This causes a relatively long upper lip, which hides the teeth when smiling and makes people feel like they don't get the most out of their smile. This can be corrected through a relatively simple procedure with an incision hidden underneath the nose. The third most common procedure for lip enhancement is a lip reduction, which is great for patients who have overly large lips that feel that this distracts from their facial appearance. A lip reduction is thus performed to decrease the size of the lips. Great news with this procedure is it's done with incisions that are inside of the lip, so there's now outward signs of surgery. All three procedures are great, but must be tailored correctly to the right patient. There are several key elements to success in a really well done lip enhancement procedure. Number one is a great plan. The lips are a central and dominant feature of the face and essential for a great smile. We evaluate the lips as part of a comprehensive facial analysis so we can understand their anatomy perfectly as well as how they fit in with the rest of the face so we can develop the right plan to make everything look great together. Number two are precise and meticulous surgical techniques. The upper and the lower lip are two different structures and must be addressed separately and uniquely. And at the end of the day, they need to look great together. So you've got to develop an individualized plan for each. And number three is keeping it natural. We want to perform lip augmentation and other enhancement procedures that really accentuate the face. And so we want natural and full appearing lips without going overboard. We never want to do too much to get that puffy and unnatural appearance that really doesn't look great. Keeping it natural keeps things in line with the rest of your face so that your lips can accentuate everything rather than detracting from it. Recovering from a lip augmentation is really pretty straightforward. If we're using Juvederm augmentation, it's done in the office and people can leave and go about their normal activities immediately. If we do facial fat grafting for lip augmentation, it's a procedure that takes less than an hour, it's ambulatory, and you go home afterwards. Whenever we perform lip augmentation, there's always a little bit of swelling after surgery, and so we have patients keep their head up as well as use ice and anti-inflammatories to minimize that during that phase. That clears up pretty quickly though, and relatively soon patients are looking great and can go back to their lives enjoying their full, more sensual, and more beautiful lips.